Hello and welcome to Module 1 of the AMI Pro and Metagenics Nutrition Masters course. In Part 1, we'll be having a look at the all-important issue of gut health. Unfortunately, gastrointestinal symptoms or disease are very common and afflict up to 70% of the world's population in one form or another. Being a very vital yet sensitive organ, a variety of insults can result in dysfunction, which can lead to a variety of clinical manifestations. It is therefore imperative to normalize gut function, thereby providing relief for a number of diverse diseases. The gastrointestinal tract consists of a long tube with different parts along the way. Most people associate these different parts with the basic tasks of digestion and absorption of nutrients, as well as elimination and detoxification. However, whatever affects gastrointestinal health will also affect nervous system function, as well as hormonal function throughout the body. The gut is actually loaded with neuronal cells that release the very same neurotransmitters found in your brain: serotonin, dopamine, GABA, and so on. Most of the serotonin that your body produces actually comes from the gut, not the brain. In addition to these neurotransmitters, approximately 60% of the total immune system and more than 80% of the immunoglobulin-producing cells are located in the mucosal lining of the gastrointestinal tract. This lining, known as the gut-associated lymphoid tissue, works to differentiate friend from foe and will activate the stress and immune response in the body. The cells in the intestinal epithelium form tight junctions or connections between each other and actually form a physical barrier between the molecules in the lumen of the intestinal tract and the inside of the body. Under normal healthy conditions, this barrier does not allow flow of matter from the outside or the lumen to the inside of the body unless the matter goes through a cell. Here we can see active transport of a glucose molecule through the cell and into the bloodstream. Many dietary and lifestyle factors, such as high fat intake, alcohol consumption, and medications, as well as infections, can cause widening of these tight junctions between the gut cells, and this causes gaps in the barrier. Without this barrier, molecules of all types are able to go around the cells and get into systemic circulation, a condition known as intestinal hyperpermeability or leaky gut. The result is that molecules can activate the immune system and initiate an inflammatory response, which can cause both local intestinal symptoms as well as systemic extraintestinal diseases. In fact, research has shown associations between compromised gut function and conditions as varied as rheumatoid arthritis, asthma, osteoporosis, and eczema. A leaky gut places a tremendous burden on the liver. It now has to process very high quantities of toxins, which results in increased stress and inflammation, both on the liver and systemically. This illustration depicts how abnormal intestinal permeability can result in increased exposure to gut-derived antigens and toxins, which activate the immune system and place additional strain on the liver, ultimately driving an inflammatory response throughout the body. Intestinal hyperpermeability is commonly seen in patients with intestinal inflammation, food allergies or intolerances, and celiac sprue. It has also been documented in patients after radiation or chemotherapy. Endogenous toxins such as bacterial and fungal byproducts produced by resident flora, and exogenous toxins like incompletely digested food particles, food additives, alcohol, over-the-counter drugs, and foreign microbes can also negatively influence intestinal integrity. This article highlights how a leaky gut is considered an initiating trigger for autoimmune diseases such as celiac, and may also be considered as a trigger for other autoimmune conditions such as rheumatoid arthritis and fibromyalgia. Other research has linked a leaky gut to inflammatory bowel disease as well. So as you can see, A variety of chronic conditions can be triggered and driven by altered gut permeability. Let's have a closer look at inflammatory bowel disease. Here we can see some interesting images of a healthy versus an inflamed and diseased gut. There are two kinds of inflammatory bowel disease, namely ulcerative colitis and Crohn's disease. One of the main differences between the two is the distribution of the inflammation within the gut. You can see that the ulcerative colitis is more continuous in the colon and involves the rectum, while Crohn's is segmental and can sometimes involve the small bowel as well. This table summarizes some of the key differences between the two conditions. As far as symptoms are concerned, both conditions present with diarrhea, although blood is rarely seen in Crohn's. It's more a symptom of ulcerative colitis. There's also differences with regards to the depth of the inflammation, as well as complications. Irritable bowel syndrome, or IBS, is another common concern that affects millions of individuals. It's essentially a diagnosis made by exclusion of other conditions, such as inflammatory bowel disease or neoplasms or celiacs. If no other diagnosis can be made, then the cluster of symptoms, which can range from diarrhea to constipation or alternating of the two, abdominal pain, distension, bloating, they are called IBS. Unfortunately, it's quite a treatment challenge as well, as it is a condition with many different causes. Here we can see just some of the main causes, which range from digestive concerns, such as hypochlorhydria, pancreatic enzyme deficiency, or infections from a variety of origins. Dysbiosis, or an imbalance in microflora, could be a contributing factor, or even food allergies. One particular culprit from the diet is gluten. You can see from this study in a group of IBS patients that did not have celiac disease, when they were following a gluten-free diet, they managed to achieve a satisfactory level of symptom control, thereby indicating that gluten is indeed a trigger of gut symptoms, even if you don't have celiac disease. Dr. Kenneth Fine has actually investigated the prevalence of gluten sensitivity in various patient groups, and he found that the percentage positive stool test is markedly high in those patients with a variety of conditions, from autoimmune states to abdominal symptoms, chronic fatigue syndrome, and microscopic colitis. Even 29% of the healthy volunteers tested positive for gluten sensitivity. Dysbiosis is a term used to describe an imbalance in the location and population density of the various bacterial organisms in the digestive tract. You can see from the diagram that the distribution and frequency of these microorganisms varies considerably throughout the gastrointestinal tract, with the greatest density and variety occurring in the large bowel. When there is dysbiosis or an imbalance, it can place tremendous stress on various organs and contribute to chronic illness. We know that these microorganisms play a vital role in protecting us from pathogenic microbes, as well as having an influence on our immune cells through communication with our intestinal epithelial cells. Researchers have studied the link between dysfunction of the gut-associated lymphoid tissue, the GALT, which is the immune system in our gut, and the gut bacteria, and how the interaction between the two can affect mucosal integrity, as well as immune activation, inflammation, and permeability. Disturbances in our microflora result in a dysregulation of our immune system, and this underlies disorders such as inflammatory bowel disease. Altered microflora, or dysbiosis, can lead to systemic immune imbalances through the impact it has on our gut immune function, which in turn influences cytokine production. Interferon gamma and interleukin-10 are typical cytokines which can be affected, which in turn contributes to an imbalance in the activity of our adaptive immune system, such as our T helper cells 1 and 2. These helper cells can be either up or down regulated as a result of cytokine imbalance. This can manifest as either increased allergic response in the case of Th2 dominance or an increased inflammatory response in the case of Th1 dominance. Studies have also found that reduced bacterial diversity in infants is actually associated with increased allergy in the first 6 years of life. This supports the hypothesis that intestinal microflora are an important consideration in the development of allergic disease. We know that diet and lifestyle factors play a major role in the development of gastrointestinal issues, and here we can see some of the major contributors. A high sugar, low fiber diet with lots of processed foods, frequent alcohol consumption, as well as specific meds which are used quite frequently, your anti-inflammatory NSAIDs, antibiotics, and antacids. Antacids are commonly used for the management of heartburn and indigestion, but unfortunately, they're not really addressing the reason for the discomfort, and over the long term can actually contribute to gastrointestinal symptoms because of the effect they have on microflora balance. This study found that patients using proton pump inhibitors, which are prescription for reflux or for heartburn, and they found that these patients had a significant increase in stomach bacterial infections. So while the drug was effective at managing the symptom of heartburn or reflux, it had major side effects. It's also been linked to affecting the levels of digestive factors, so it hinders adequate digestion, can increase the risk for H. pylori infection, as well as dysbiosis, and a condition known as small bowel bacterial overgrowth. Functional dyspepsia is another common concern for people, and typical symptoms of this condition range from heartburn to an upset stomach, nausea, and bloating. That needs to be a problem for at least 12 weeks over the last 12 months. It is another condition that can actually be caused as a side effect of frequent use of anti-inflammatory medications like aspirin and NSAIDs. Gastrointestinal complaints are among the leading reason for people to seek out healthcare and the most common reason for hospitalization. There are literally millions of people suffering with some kind of gastrointestinal disorder, which can range from mild symptoms to those serious enough to interfere with their normal life. But diagnosis of the disease is really only the first step, and we see that traditional suppression of the symptoms with medication can actually exacerbate other gastrointestinal concerns. So we need therapies that address the underlying cause of the gastrointestinal distress. And so I'd like to introduce you to a system called the 5R Gastrointestinal Restoration Program. This system allows you to evaluate and target your therapies aimed at improving overall gastrointestinal function. The program simplifies the complex interactions and systems by asking 5 main questions. Number 1, what does this patient need to have removed? Here we will consider things like pathogens and allergens in the diet. Number 2, what does this patient need to have replaced in order to aid optimal gastrointestinal function? Here we'll consider things like digestive enzymes and stomach acid. Number 3, what does this patient need to support and or re-establish healthy microflora balance? So do we need to re-inoculate with a probiotic and possibly prebiotic support? Number 4, what does this patient need to support the healing of the mucosal layer? How can we help to regenerate? And lastly, number 5, can we provide nutrients that can relieve acute symptoms and discomfort? Remove focuses on eliminating pathogenic bacteria, viruses, fungi, parasites, and other environmentally derived toxic substances from the gastrointestinal tract. Potentially allergenic foods and inflammatory foods should also be avoided. Dietary modification is very important, since foods to which a patient is intolerant or allergic can exacerbate gastrointestinal dysfunction and stimulate immune and inflammatory responses systemically. Several studies have shown that avoidance of the suspected foods can lead to a substantial improvement in clinical symptoms, and so the elimination diet is an important part of the remove phase. In this diet, one would typically exclude all potentially allergenic or inflammatory foods that are listed here. This would include all dairy, soy, and gluten and corn containing products. Shellfish and certain red and processed meats also need to be avoided. Any alcohol and caffeine containing products, refined carbohydrates, and as much as possible any non-organic food sources. After 3 to 4 weeks on the elimination diet, once gastrointestinal symptoms have improved, one can challenge the patient and reintroduce one food at a time. Eat it multiple times over the course of 2 to 3 days and check for symptoms. If none, then move on to the next food to be reintroduced. However, if there is a reaction, you know to eliminate the food for a longer period or either permanently. Pathogens are also important to consider, as they can take up colonization anywhere in the gastrointestinal mucosa, and cell wall components of the bacteria, yeasts, or parasites can be absorbed, which can cause a systemic symptom or reaction. Removal of the pathogens is key to gastrointestinal restoration. Some of the main ones to consider are Helicobacter pylori, which is a bacterium that can infect human stomachs. It's estimated that up to 2/3 of the world's population is infected with this bacterium. And this infection has been associated with gastritis and is a leading cause of gastric and duodenal ulcers. Candida is another common opportunistic yeast overgrowth, which can occur due to stress, diet, and lifestyle factors. Parasitic microbes from the external environment may be unwashed fruits and vegetables. And then small bowel bacterial overgrowth is a condition in which misplaced colonic microflora, or pathogenic growth, has grown up into the small intestine, where it interferes with normal function. It is a condition that's been documented in patients with varied conditions, such as rheumatoid arthritis and irritable bowel syndrome. Several volatile botanical oils are effective in eliminating imbalanced microbes from the upper gastrointestinal tract. In several studies, oregano has exhibited high levels of antimicrobial activity against a wide range of gram-positive and gram-negative bacteria, parasites, and fungi. Red thyme oil is another option. The primary active thymol has got an action in the upper respiratory and gastrointestinal tract. Lemon balm leaf supplies flavonoids, which support the action of the immune system. These compounds have potent antiviral activity, and in traditional Chinese medicine are used to assist digestion whilst harmonizing healthy gut and respiratory environments. Sage is also antibacterial, antifungal, antiviral, and astringent. It is indicated for use in digestive complaints, flatulence, inflammation of the intestines, and diarrhea. For lower gastrointestinal imbalances, consider berberine, a plant alkaloid with a long history of medicinal use in both Ayurvedic and Chinese medicine. It is present in golden seal, coptis, Oregon grape, and tree turmeric. The berberine alkaloid is found in the roots, rhizomes, and stem bark of these plants. Berberine extracts and decoctions have demonstrated significant antimicrobial activity against a variety of organisms, including bacteria, viruses, fungi, protozoans, and chlamydia. Currently, the predominant clinical uses of berberine include bacterial diarrhea and intestinal parasite infections. If you'd like to read a bit more about herbal antimicrobials, please request this ANSR article from your AmiPro rep. Saccharomyces boulardii is another great tool. It is a probiotic yeast organism that exerts a competitive effect on pathogens in the gut. Here you can see that it has been found to be effective against a range of bacteria and fungi, including Clostridium difficile, which has been associated with antibiotic associated diarrhea, as well as Candida, E. coli, and Salmonella. This brings us to our second R, replace. Replace refers to the replenishment of enzymes and other digestive factors that are lacking because of whatever reason. Gastrointestinal enzymes that may need replacement could include your proteases, lipases, and saccharidases that are normally secreted by the gastrointestinal tract or by the pancreas. There might also be a lack of stomach acid, which would then advocate the need for replenishment with betaine hydrochloride. You may also want to add the digestive enzyme pepsin. Bile flow could also be a problem that is hindering adequate digestion. This could be as a result of inadequate factors for the synthesis of bile, or the gallbladder might not be contracting properly, or it might not be stimulated because of some pathology to the small intestine, so that the signal isn't going through. So that might also be contributing to digestive problems, and you may want to add some support there. So let's look at lack of stomach acid, or hypochlorhydria. It is a condition that actually becomes more and more prevalent with advancing age and is often found and associated with atrophic gastritis. Evidence suggests that hypochlorhydria can occur in 20 to 30% of the older population. It's also been associated with increased Helicobacter pylori infection, increased gut permeability, and reduced intrinsic factor secretion. Intrinsic factor is necessary for the absorption of B12. So you will have some issues with regards to B12 absorption if you have low stomach acid. So what are the symptoms of hypochlorhydria? Well, it's been associated with a sense of fullness directly after eating, like the food is just sitting in the stomach. Belching, burning, burping, and flatulence that accompany meals, as well as a feeling of discomfort because of excess gas in the upper intestine. There may also be undigested food in stool because the food is not being digested properly higher up in the digestive tract. And multiple food allergies and sensitivities, because again, the lack of adequate digestion means undigested food particles are moving lower down in the digestive tract and causing irritation. Another clinical symptom could be peeling or cracked fingernails, which could be a result of poor mineral absorption because of the low stomach acid. If hypochlorhydria is suspected based on the symptoms, you could consider using this simple home test to determine if there is a deficiency. The bicarbonate test involves taking a quarter teaspoon of bicarbonate of soda in a quarter cup of water first thing in the morning on an empty stomach. If belching is caused, then stomach acid levels are okay. However, if there's no reaction, it could indicate that you have low stomach acid. If hypochlorhydria is suspected, one needs to utilize a betaine hydrochloride complex with pepsin that should be taken before a protein-containing meal. This can really help to address symptoms that are associated with hypochlorhydria, such as indigestion, bloating, and heartburn. It's important that one individualizes the dosage as people will have varying degrees of hypochlorhydria. And typically you can ask your AMIPRO rep how one would titrate the dosage and determine the individual dosage that needs to be utilized. But what is interesting is that after using the optimal level, you will have improved digestion, and tissue synthesis of hydrochloric acid in the stomach will actually start to improve, and over time your dosage requirements will reduce. So it's not something that needs to be continued at a high dose forever. Pancreatic enzyme secretions also decrease with age and can be suppressed by alcohol abuse. If there's any diseases of the pancreas or gallbladder, it can also affect the production of enzymes. Food allergy has been associated with inadequate digestive enzymes. As mentioned before, the poorly digested protein fragments can leak across the gut wall into systemic circulation. Therefore, symptoms associated with food allergy could actually suggest impaired digestive function and enzyme deficiency. Digestive enzymes to support optimal digestion can be taken orally. They can be derived from either plants or animals and are better if taken separately from acid-replacing nutrients, as this allows for individualization of the digestive supplement doses, as not everyone needs both stomach acid and enzymes. In contrast to the stomach acid, which is taken before a meal, enzymes are best taken 30 to 45 minutes after a meal. Bile salts are essential in aiding the action of enzymes and work to enhance the absorption of fatty acids and fat-soluble vitamins. If the gallbladder is not working properly or is not being stimulated properly, fats can't be digested, leading to fat malabsorption and also deficiency in fat-soluble nutrients. One could consider using specific nutrients that support bile flow and synthesis. Taurine is used to make bile salts, and without enough taurine, gallstones are more likely. Vitamins B6 and vitamin C are also cofactors in bile synthesis, while magnesium, folic acid, and B12 will help with detoxification and overall liver function. Artichoke has been traditionally used to treat indigestion, and together with chenpi is a bitter herb that will stimulate gallbladder contraction. This brings us to our third R, reinoculate. Reinoculate refers to the reintroduction of desirable bacteria or probiotics into the intestine to re-establish microflora balance. Probiotics synthesize various vitamins, they produce short-chain fatty acids that are necessary for colonic cell growth and function, and they also help to degrade toxins and prevent colonization by pathogens. They also help to promote a healthy, balanced immune and inflammatory response. When it comes to which probiotics to select, it's important to utilize identity-certified strains that are backed by research with proven clinical benefits. Two such strains are Lactobacillus acidophilus, NCFM, and Bifidobacterium lactis, BIO7. These two strains are actually two strains found in the human intestinal tract. They have been verified as being strains with demonstrated positive effects that range from immune modulation to anti-carcinogenic, antimicrobial effects, can help to fight candida and help with digestion of lactose. And they've actually been proven that they are able to exert these positive effects, being able to survive intestinal transit and adhere to the intestinal epithelium and so forth. In addition to those benefits, there have been multiple articles utilizing these two strains in managing irritable bowel syndrome. In the fourth R, regenerate, we are looking at providing support for healing and regenerating the gastrointestinal mucosa. The regenerate phase will, of course, have benefited from all of the approaches used in the previous R's. remove, replace, and re-inoculate. But there are still some additional factors that can help with healing of the mucosal barrier, production of mucin, and the support of microflora. Phosphatidylcholine from soy lecithin, as well as plantain and D-mannose, an oligosaccharide from cranberry, work to stimulate gastrointestinal mucosal cells and mucin production. Specific prebiotic fibers such as arabinogalactans from larch gum and rice bran fiber are able to support the growth of beneficial microflora such as bifidobacteria and lactobacillus, whilst inhibiting the growth of pathogenic bacteria like Clostridia. And they also reduce the activity of the enzyme beta-glucuronidase, which is responsible for the reabsorption of toxins from the gut into systemic circulation. So down-regulating that enzyme is a good thing. Cinnamon can also be useful in retarding the growth of Helicobacter pylori, and green tea extract also has an inhibitory effect on this problematic bacterium. The antioxidants astaxanthin and vitamin C also work to support and protect gastrointestinal mucosa while balancing the microflora in the gut. The amino acid L-glutamine is a fuel for the colonocytes and therefore help them to regenerate. It's been found that there is an increased need for glutamine during times of stress, injury, sepsis, and inflammation. And animal studies have also found that gut immune function can be improved by administering glutamine because it is utilized in the synthesis of secretory IgA. Some other components to consider in the regenerate phase are your omega-3 fatty acids, particularly EPA, which can have an anti-inflammatory effect, aloe leaf extract, and deglycerized licorice. Both have very soothing properties for the mucosal lining of the GI tract. This brings me to our fifth and final R, relieve. Here we want to provide relief for gastric and intestinal discomfort. Certain herbs, such as licorice root, astragalus, and ginseng, can help address symptoms of heartburn, acid indigestion, and an upset stomach, as they are known to support the health of the mucosal layer of the stomach. For lower gastrointestinal relief, antispasmodic herbs such as peppermint, chamomile, and lavender oils can relax the intestinal smooth muscles and support colonic motility. Zinc carnosine is a gastro-supportive complex that has been found to yield promising results in enhancing gastric mucosal defenses as well as modulating Helicobacter pylori growth. It has been shown to relieve a number of dyspeptic symptoms such as heartburn, nausea, an upset stomach, and abdominal distension. The results of this study show a 92 to 100% relief in just 8 weeks. Here they were considering factors such as heartburn, nausea, and bloating. Clinical trials have confirmed not only symptom relief, but actual healing, which was confirmed endoscopically. There were also no side effects in any of the subjects. So this is an incredibly effective yet safe natural alternative. Zinc carnosine has been clinically demonstrated to be an effective adjunct to antibiotic therapy in H. pylori eradication. When combined with the conventional therapy approach of triple antibiotics, it was found to significantly improve the eradication rate of the bacterium without an increase in side effects. Zinc carnosine's unique transport capabilities are thought to be dependent on its ability to remain in the gastric juice without immediately being destroyed. So by prolonging its existence, zinc carnosine is able to maintain tissue supportive effects for a longer period of time. The activities of zinc carnosine include being able to protect cellular integrity through antioxidant activity, protect gastric epithelium by stimulating mucus secretion, reduce gastric inflammation by inhibiting expression of inflammatory cytokines, being able to adhere to the wound site, and to have a direct inhibitory effect on H. pylori function. If you'd like to read a bit more on the research behind this specific zinc chelate, zinc carnosine, ask your AmiPro rep for this ANSR article. Right, so in summary, the 5R gastrointestinal program is a very comprehensive approach aimed at restoring optimal gut function. Here we consider 5 aspects: remove pathogenic microbes, dietary triggers and allergens. In replace, we're going to replace digestive compounds and enzymes. In reinoculate, we're going to use beneficial microflora. Regenerate with specific nutrients that can support the gastric and intestinal mucosa, and relieve specific herbs and nutrients that can calm and relieve symptoms. We have another ANSR article called The Benefits of Applying the 4R GI Restoration Program. This is essentially the same as the 5R, it just does not include the relieve step, but it gives a wonderful insight into the application of this program. So you can also request this article from your AmiPro rep should you wish to read it. So remember, when we heal the gut, the entire body will benefit. Thank you very much, and I'll see you in part 2, where we'll be looking at specific Metagenics products and protocols that can be used within the 5R framework.